but it all has limited effect. I could only go so far, bringing the patient in their own subjective state to make them comfortable and allow them to really get the care that I think they needed. You see, if the patient is in that frozen state, they can't be a resource, they can't be a support for themselves, they don't know how to choose what's the best care for them, and they have difficult time communicating with the dental staff. So how do we intersect this? Well, over the course of the years as I've worked, I try to coax people, and that's all, coax them. And I found out actually why I did that, and I'll be talking a little bit about some of the science behind it. But to kind of dip the toes in, I want to share a great patient I know. She's been a patient for about 10 years, and her name's Kathy. Kathy, she is really bubbly, a great personality, but you know, she just really hates coming to the dentist. And you know, she doesn't, I have nitrous oxide, you know, helping out to sedate and relax and calm. She doesn't like to use nitrous oxide. She doesn't use any of the little gizmos that I have. I went to a course and I got this biomodulator. It's a little electric stimulator. If you use it correctly, it looks like a little electric shaver, but it sends these little electric signals to the nervous system, and it helps to calm them. And I said, gosh, this is great. Kathy would be a great patient to use it on. So as I always do, I explained what my process was, what I think will accomplish, and she said, okay, whatever. So we did it, and you know, I thought it worked great. But she came back the following visit, and she said, before we even started, she said, Doc, what did you do to me? I was calm, I was quiet. It just freaked me out. You know, she uses her talking about her family and her work environment, and specifically why she doesn't like coming to the dentist. And I shut that off for her, and she didn't like that. Yeah. So, lasers, that's what you're here to hear me talk about. The power of light. I think for you to get the most out of this, you know, I could spend all night long talking about this hard tissue laser. It's a 2940 nanometer laser. It can treat teeth with less vibration, pain, and it's great. But the real reason I got it, it's because they said that it could numb teeth. I had some issues throughout the course of my practice where I work on patients and get great results, but about 10 to 15% of the population, I had a tough time getting numb. So with this laser, and laser stands for light amplification of stimulated emissions of radiation. And basically what that means, and I think how this works is that, and how this works, this cold laser, is that it connects with us because we are lasers, we are light bodies. And I'll explain that a little bit. Maybe to get a little bit of insight into that issue, light amplification of stimulated emission of radiation. It's a mouthful for sure. LED is a lot shorter. It's a light emitting diode. So a diode, they send an electrical current through this little electrical piece, and it shoots out light. LEDs do it in a way that's spontaneous, meaning that it's random, so that the waves that come off of it go in different directions. They could be the same color, they could be coherent initially, but not really. So we are a light bulb, and we are a laser. How a light bulb is relative to how lasers work. As with LEDs, the light comes off random, but there are different colors, meaning different wavelengths and different frequencies that come off. So what makes lasers cool is that, you know, you have the James Bond movies and the planetarium light shows of the 70s. But lasers are basically fast color, fast and powerful color. So getting back to the erbium story, the way the heart tissue, this is a heart tissue laser, and I can do fillings and numb the tooth. How I numb the tooth is through a process of using the fluence. Fluence is laser energy, water, and air mixed together. And how you use the fluence, over the tooth you bathe it for about 3 to 5 minutes. You do the outside of the tooth, you do the inside of the tooth, the top of the tooth, but you know what? As I said, I had problems with about 10 to 15% of the patients that I got numb. Well, I also had 10 to 15% problem with those when I was using the laser. Go figure. So maybe there was something else at play. So with hard lasers, I have a handout for you, and in the handout there's a chart, and the chart shows different lasers. This is a soft tissue. This is an 808 nanometer wavelength soft tissue laser. So with the hard tissue laser, it interacts with water. The tooth is made up of different layers. The outside shell is the enamel. The inside dentin, the inside is dentin, and the inside of that is the pulp. Well, with the enamel has less water than dentin, so you need more power and repetition rate in order to be able to gain access to it. To be honest, kids' teeth, they do a lot better because the teeth are thinner, the enamel's thinner, and they just respond way better. But maybe there's something else. The soft tissue laser, this connects with blood. And what it does, it vaporizes, and this is the James Bond fun stuff, so that you're not just grinding and cutting and all these things that the older technologies are doing, you're vaporizing. So as the lasers connect with the tissue at the right frequency, using it correctly, poof, it just goes up in smoke. So that's great stuff, but I bought this $50,000 laser so that I could get people numb because they said they did. It said it did it. Even more powerful, because we're talking about the light bulb, LEDs, lasers. Well, this is the Lumilight. This is color therapy. This is a green mineral and glass cover, which in many ways is actually more powerful than lasers. The lady who did the research shows that our human body gives off 1.7 volts of potential. Well, this is run by a 2.3 volt incandescent bulb. So in many ways, this can connect with the body better. But as a way to kind of delve into this a little bit more, the issue is actually within the individual. That's really where the true secret resides. Because I was doing my research, and I was trying my best to search out a